I want to talk really briefly about direct primary care versus concierge care. And this can be a confusing topic for physicians to understand exactly what each one means. There's everybody that's in the fee for service model that takes insurance, and then they often hear about primary care doctors or specialists that are direct care or concierge care, and it's easy to lump them together when really they're quite different. So, when we talk about direct primary care, what we're talking about is cash based, meaning we don't take or bill insurance. Now, oftentimes patients will use credit card, HSA, checking account, those sorts of things to pay for their services. And it is a monthly membership fee that provides you access. So instead of coming into the doctor and getting a insurance claim, a EOB, a 99213, all of those different things for each visit, patients pay a monthly membership fee that gives them access. This does, for DPC doctors, allow them a lot of different ways to take care of patients because it frees you from having to come into the office for every little thing. A lot of our care is provided over text message because, as a pediatrician, all my millennial and Gen, whatever is after millennial, Gen Z patients love text messaging, and so they prefer to text pictures of rashes. We're able to chat it up over text message, like, tell me about the history, what's going on with this rash, what have you been putting on it. We're able to solve a lot of problems over text message rather than having them come in for every little thing. Direct primary care also works well with telemedicine visits, or a combination where instead of having to come into the office, it's something that we can talk through over the phone or over Zoom or something along those lines. That works well. Contrast that with concierge care. Traditionally, concierge care looks like we still bill insurance, plus there's an access fee that gets you in the door to the clinic. This gets a little bit more sticky when it comes to insurances, and a lot of insurances don't like it because essentially what you're doing is you're billing insurance, but you're also collecting $1,000, $5,000 per year as an annual fee, or split up over months as a monthly fee for access to the clinic. With that, they typically get more touch points and closer access and easier communication and all of those sorts of things. And so really, the two big distinguishers are how we play with insurance. Direct primary care just does not play with insurance. Concierge care typically does still bill insurance, still does copays, still does deductibles, still does all of the EOBs and everything along those lines, and also has an access fee on top of that just to get into the door. I kind of think of it like you go to a country club, but you also have to pay the member fees for using the golf carts and the golf course and buying dinner and all those things versus some sort of club where you just pay to join and then everything is free. I don't know if that exists, except in direct primary care. One of the other distinguishing factors is the size of your team. If you are a concierge practice and you have insurance billers and receptionists and nurses and the whole slew of people that you think of that are required around the doctor in order to both provide the care and administer the care, that creates a large team, which is why you do have to have a large fee to support that and bill insurance. Direct primary care, we have small patient panels. We limit the size of our team because we don't need all of those people. We don't have somebody on our team that takes care of insurance billing and credentialing and manages claims and works on denials and all those sorts of things. That team member just doesn't exist for us. And so we run a much leaner team than when you have to see a lot of patients, when you have to bill insurance, and you have to deal with all of the things that come from billing insurance. My practice, we started, I have myself, we don't have a regular nurse. We have a part-time RN that does a lot of administrative work in addition to rooming patients when she's here, but she does a lot of the administrative work that's required of an RN. But it's myself, we have a part-time nurse practitioner, a full-time PA, an office manager, and then somebody that helps with projects and our books and those sorts of things, like QuickBooks and those sorts of things. Most direct primary care practices start with just the doctor and then typically like a medical assistant, office manager, RN, something that can be a multiple different people. They wear multiple different hats. And that's typically all that a direct primary care practice starts with, which does put you in the driver's seat a lot more and like you interacting with patients in a way that you're not used to. I did not give a lot of vaccines before I started my direct primary care practice. Luckily, I knew that was going to be what I was going to be doing. So as I was wrapping up in my fee-for-service practice that I used to be a partner at, I did give vaccines for practice. You do a lot of the things that are kind of actually fun once you get into the thick of it. Like, I don't mind giving vaccines. We weigh babies, we measure babies, we do their head circumference, we do all of those things ourselves. And it sounds like, oh, that would be terrible, but it's actually another just chance to connect, build that relationship, chat with the patients and their parents as we go about, and it streamlines the visits. And so those are the big distinctions between direct primary care and concierge care, which is a common question when people are exploring it or they're really not sure, or they've heard of it but they're not really entirely clear on what it is. If you have questions about direct primary care, drop them in the comments. Would love to answer more questions and help you, especially if you're thinking about maybe direct primary care is for me.